And doctor, what do you mean when you use the word pandemic? Welcome.
Hi, it's nice to join you. And I do think that we are heading towards a pandemic, which means that it's a sustained community transmission that's not just with people who have been to the epicenter, to Wuhan, China, but it's person to person in the community. This is what we're seeing now. Now we have over 30 countries where there is this novel coronavirus, and many of these cases are not related to travel. We are now also seeing countries that don't have well-developed healthcare systems. And I am very worried about what happens when this outbreak hits those countries. It's very likely, too, that the numbers that are being reported are an underestimate, that there are a lot more people who have mild or no symptoms, who are not being counted, who are not being tested, who may actually have coronavirus and be spreading it to others.
Yeah, and you get that, Dr. Wen, because there's a couple hundred people in Italy that ostensibly have the disease. Italy, of course, has a population of 60 million. So China is more than, 20, 25 times larger than Italy. Do you think that China is purposely underreporting its numbers, or do you think they genuinely do not know?
There are many reports of hospitals running out of testing kits, and it seems that there just isn't information about how many people who could be out there, who could be infecting other people, and just don't know it. And I think Italy certainly gives me concern, too, that these are the cases that we know of, but how many people are not yet being tested who have the disease?
You know, one thing, doctor, if it's true that the number of cases ultimately underreported, but the fatality rate stays the same, then in a way you could say that's encouraging. Do you expect both of those to increase, both the number of people who have it and the fatality rate? And is it maybe helpful that at least some of the Western countries could give us more transparent information?
Well, right now, the fatality rate for this novel coronavirus looks like it's about 2%, which is significantly lower than SARS at 10%, although it is higher than influenza, which is 0.1%. So it is possible that over time we might find out that there are many more mild cases, and then that denominator is going to be increased. To your point, though, I think transparency is so critical. Public health depends on public trust. And the U.S. government has been very good about being transparent about their responses. A changing response actually is a good thing, as long as someone explains why that change is happening. It just means that you're being nimble and agile and responding to the most recent information, which is what the U.S. government is doing. I am very concerned about China and some of these other countries where coronavirus is now spreading to. If they have unstable government institutions, if the public already doesn't have trust in the government, that could make the outbreak much more difficult to contain. And diseases know no boundaries, so we're only as strong as the weakest country in the world.
What's our status, doctor, here in the United States? I flew this week and the plane was packed. You live in Baltimore. Would you get on the Acela? Would you get on a flight of BWI right now?
Well, I am 8 months pregnant, and so I myself might not be getting on too many modes
and a
of
baby into it, yes. But how about for those who may not be pregnant?
The most important thing is that this is a very quickly evolving situation. The risk to the everyday American right now is very low, but that may change at any given moment. And so watch the Centers for Disease Control and Prevention website. If you're planning any travel, heed the guidance from public health officials. Don't go to areas that currently are under travel restrictions. And remember, too, that influenza and colds and other diseases are spread the same way as coronaviruses. And so wash your hands carefully. Don't go around other people who are sick. Stay at home if you are ill yourself. And these are all good things that you can do to prevent yourself and your loved ones from getting sick.
You know, doctor, real quickly, that just reminds me, we've had, flu and colds and this and that go through our house. And my efforts to bleach and quarantine did nothing to stop it. So listen, what would your best advice be is it just immunocompromised people who should basically self-quarantine then? And when and for how long a period are we talking? Because it's really hard to stop these things from infecting you once they're out there.
And that's why the best thing that we can do is to wash our hands a lot. I know that sounds very simple and very basic, but at the same time, while we're waiting for treatments to be developed and vaccines to be developed, which could take months or more than a year, the best thing we can do is just watch our personal hygiene and watch the travel advice and other guidance, because this will be moving very quickly.